Uh, Hi, good evening, everyone. Good evening, Dr. Jitesh. Good evening, Dr. Jatin. Thank you so much for joining us for this lovely evening. We'll wait for another 5 minutes to let everyone join.
Good evening, Simran. Good evening, Jatin.
Good evening, everyone.
Good evening to everyone who found time on Sunday to join us. We'll just begin in some time. Thank you. Simran, I think we can begin.
Yes, Dr. Jitesh, definitely.
So thanks everyone for joining. And as people continue to join, I think we will continue to run the webinar. uh, take this opportunity to give some time for Dr. Jatin maybe to introduce himself. Dr. Jatin, would you like to start with an introduction for the people that are in the call and the webinar?
Yes. So good evening, everyone. I'm Dr. Jatin Yegurla. I'm a medical gastroenterologist, hepatologist, and I'm working in Apollo Hospitals in Hyderabad. I've been trained in PGI Chandigarh and AIMS Delhi, and which has a very high volume of patients, and mostly the refractory patients who've been neglected are referred to these centers, and we had significant burden of IBS. So I'll be happy to share whatever I can to help in IBS patients.
Thank you so much, Dr. Jatin, and really, really happy to be able to take this through. I think the best way to start is to set some understanding around the disease subject itself. Many people have various version of the disease, and it would be amazing if you can take our viewer through the entire ecosystem of what is IBS, what does it mean, and how does it really impact someone's life.
Yeah. So just as an analogy to the gastric issues like acidity or gas, there's no universal definition for it, and many people perceive their symptoms to be, gastritis or acidity. Similarly, there's a lot of misconception around IBS. So IBS is a chronic condition in which the patients either have one of the three cardinal symptoms, either pain abdomen or abdominal discomfort, and altered bowel habits. Can either be constipation or diarrhea, and there can be some associated psychosocial comorbidity like anxiety, depression, or anything. It's not necessary that it may be overt. So if somebody is suffering from pain abdomen and altered bowel habits, especially for a long duration, and they're not able to find any cause despite multiple investigations like endoscopy, colonoscopy, or CT scan, they are probably suffering from IBS. So why does this happen? It is basically sensitivity of your intestine, and these people are not able to perceive the physiological stimulus properly. For example, in us, the normal peristaltic movement, the normal food digestive processes are not felt actively by the brain. In somebody with IBS, because of the hypersensitivity of the gut, there is even the minor stimuli trigger a sensation of pain, and that is how these patients have symptoms that are disproportionate to the amount of disease that they have. So it can be reason could be, it can be genetic, it can be because of environmental changes, the diet that you had in the childhood, the kind of stressors, and your emotional states that you've been exposed to, childhood trauma, multiple things have been attributed your gut microbiome. But altogether, in the end, you become susceptible to few triggers wherein you will have these symptoms. So what are the triggers that usually, aggravate the symptoms? So the most common is GI infections. We usually are exposed to a lot of contaminated food, and most of the times we get, viral gastroenteritis, but in couple of days or maybe 3 to 5 days it settles down. For somebody with IBS, this kinds of triggers a cascade of events which will lead to persistence of symptoms, maybe be it pain, be it prolonged diarrhea, prolonged constipation or bloating. So infections is one of the most important trigger. Second trigger would be, any kind of emotional changes, and people usually say that whenever I'm going through a bad phase or anxiety, low mood, or any financial stress or family stress, interpersonal relationship, and their symptoms tend to aggravate. So the second thing after infections is stress and emotional disturbances, and some people have hormonal changes, and females tend to have symptoms that are aggravated during the time of their menstrual cycles. And in addition to these, even any kind of change in your diet, travel, will change the kind of food that you take, and the gut microbiota balance may be disturbed, and this can lead to the flare of symptoms. So most troublesome thing with IBS is that they are not properly diagnosed. Many people are there who have bloating, who have pain, diarrhea. They approach the nearby physicians, and they're given a lot of medications, which kind of give them partial relief or no relief. However, they fail to recognize this condition without thorough investigations. There is no gold standard test, to confirm or diagnose IBS. So that is a challenge, and that's why people are not able to, get the appropriate treatment. So first challenge is the diagnosis. Second challenge is, they expect that this is something short term. They expect that I take, a short course of medication and then I don't want the symptoms ever. But that is not the case with IBS. IBS tends to be chronic, and it can last for months to years and sometimes decades. This can have waxing and waning course throughout the life, and it has to be, a holistic care, leading to changes in the lifestyle and diet, along with some medication, will give you long lasting relief.
Thank you, Dr. Jatin. From patient point of view, what are those top 4 or 5 or top 3 or 4 symptoms that you would advise are kind of a warning sign, and that an IBS patient should clearly understand that, okay, it's time for me not to ignore these symptoms anymore, and I must now go and see a gastroenterologist?
Yes. So if your pain is lasting for more than a few months, so now it's not time to take, pantoprazole, PPIs, or some antispasmodics and just delaying the diagnosis. It's time that you get yourself thoroughly evaluated and check if you have IBS, and then start. So pain lasting for more than few months, and you have most of the times, if the pain is not getting relief with the regular treatment. Second, the altered bowel movements, and without any signs of malabsorption or secretory diarrhea. For example, the patient is fairly preserved, but these diarrhea tends to keep happening for prolonged duration, or the constipation is not getting relieved, then I think they have to consult. And especially the ones in whom the endoscopy and colonoscopy is normal, so in them there is a high possibility that they have IBS, and we have to look at the triggers and try to give personalized care to them.
So can we deep dive a little and try and explain to people who are listening to us on the whole role of holistic care or integrated care? What exactly is this integrated care, and how can someone embrace this to lead a better life if they are suffering from IBS?
So the first thing is that the patient, before reaching gastroenterologist near the physician, not able to reach the diagnosis is a challenge. Second, in case the patient reaches the gastroenterologist, most of the community gastroenterologists are not able to provide them adequate time because of the busy practice. And the most important thing in treatment of IBS is establishment of rapport between the patient and the doctor. It's very important on the long run, because most of these tend to go from one doctor to other without much relief with just the medications alone. So if you're taking only medications, you will never be able to achieve the full response. And it is very important that there is a three-pronged approach. One, you have to take care of your diet. We can only give some blanket statements about the diet, but we'll not be able to give you a personalized diet based on your feedback. So that part, I think, the gastroenterologist is not able to give because of a lack of time or the expertise. Second, giving gut directed hypnotherapy or behavioral therapy changes. What are the exercises? How do you control your stress, anxiety? This requires a lot of discussion and hand holding for people with IBS, but that again is lacking in the general gastroenterology medical practice. And this is where holistic care comes in. And now we have very good multi-center international trials supporting the integrated care. Especially the Mantra trial was a landmark, which has really shown us how impactful this can have. Prior to that, we were not very really giving a lot of importance, but now that we have solutions and we have evidence, we should try to incorporate integrated care for patients with IBS. The three prongs would be medical management with your gastroenterologist, the dietary management with a nutritionist who's well experienced in handling patients with gut-related disorders, and gut-directed hypnotherapy from a well-trained psychologist. Three together will definitely give significant relief, and I already have started, sending my patients for this integrated care, and I already am getting a lot of good uh, response. Another important thing is that patients have a lot of stigma when I ask them to go and meet a psychiatrist to try and identify what is going on, and get medications or counseling. So because of the stigma, they tend not to go to the psychiatrist, and they think that nothing is wrong with my mind. And we have to understand that this is a disorder of gut brain interaction. There is always a two-way interaction between a gut and brain. So whatever signals that are coming to your intestine, be it to secrete the juices, intestinal juices, or intestinal contraction, these are coming from your brain. And all the signals from your intestine, like the distension or contraction, motility, the content, all the signals are going to the brain. So when your brain is in a heightened state of anxiety or depression, so your sensitivity will increase. And unless you target both of them together, you're never going to achieve full response. So it is very important to identify what are the psychosocial comorbidities and treat them adequately along with the abdominal symptoms in order to cure them. And people usually have a vicious cycle. So the common complaint that they have is, they say that I am stressed, I am worried, this is affecting my quality of life, but only my abdominal symptoms are leading to this. If my abdominal symptoms are thoroughly treated, then I will be fine. This is what they say, and they deny taking any neuromodulators or psychiatrist advice. But what they have to understand is it's a vicious cycle. You are anxious because of your abdominal symptoms, and that anxiety is driving your abdominal symptoms. So unless we break this vicious cycle, uh, we can't treat you properly. So that's when integrated care comes into play, and it is showing good results.
Thank you, Dr. Jatin. Going in line, actually, there are certain questions posted by people who are attended, and I'll maybe take a couple of these. So this question has come from a woman who is, she's a working woman, and she is around 38 years of age. And she says, while my office life is stressful, I do have some personal stress. And you just spoke about the gut-brain axis and the role of stress. So she's asking that I can now clearly see a relationship between my stress and my gut. And maybe can doctor explain this in a little more simpler manner, that exactly why this stress has a direct impact on my gut?
See, stress has multiple effects on the gut, right from, so if we talk about the motility, so your intestinal motility is controlled by your brain. So the gut doesn't know when to contract, how fast to contract, and how much to contract. And this motility has a lot of role in, is responsible for all your symptoms. If the motility increases, there is diarrhea. The motility reduces, there is constipation. And sometimes this increased contractions will lead to borborygmy or your abdominal pain. So all this is controlled by the brain. Whenever you're stressed, whenever you're stressed, your GI motility is affected. That is number one. Second, there is a lot of sympathetic drive. There is a lot of hormonal changes, and this will lead to altered gut metabolism. And third would be change in the gut microbiota. So somebody, and now there are now therapies being targeted towards gut microbiome, which are going to treat depression. So you can understand how important the healthy bacteria in our intestine are. And this two-way relationship between your stress and the intestinal microbiome has been well established. And somebody who's depressed, they have a different set of bacteria. Somebody who's has somatization disorder has a separate set of bacteria. So how this has happened is still under investigation, but your state of mind has a lot to do with your gut microbiome. It's like a fingerprint. And one is the gut motility. Stress can increase the motility. Second, it can cause a lot of hormonal changes, a lot of catecholamine drive and sympathetic drive. Third is the gut microbiome changes. And with these three mechanisms and many other mechanisms, stress has a direct impact on your abdominal symptoms.
Thank you, Dr. Jatin. And now, very interesting question has come since we spoke about the role of stress in the gut motility and overall impact. There is a student. This person is a 22-year-old student who is doing masters and says that okay, I understand the relationship between the stress and the gastric motility, but my challenge is different. I am not stressed, but I feel bloated entire day. I am almost sure that maybe I've got IBS, and what could be the causes for me feeling bloated entire day?
Yeah. So, so apart from bloating, most of the patients never admit or never are aware of what the stress. So it might not be overt, and it is probably in your subconscious mind, and you may not be totally aware that you are even suffering from stress. So it is sometimes needs to be extracted by an expert psychiatrist or a psychologist to identify whether you are actually stressed or not. It is your perception is different, and what is actually is different. Second, if you're totally not having any kind of stress, anxiety or anything, you might still be having symptoms because of multiple reasons. So bloating can be because of multiple reasons. Bloating is when you feel early satiety, or you feel that abdomen is full, and all these things will happen when your gastric stomach emptying time is increased. That can happen due to multiple reasons. So one could be because some organic causes may be there, like for example, Helicobacter pylori infection can be responsible for bloating. Your dietary pattern can be responsible. Dietary pattern in the sense somebody who's consuming a lot of deep fried, oily, fatty food or overeating. Naturally, your stomach is not having the capacity to digest and move the food as rapidly as it can. Sometimes with age, your capacity will come down. If you say that I'm young, I don't have stress, I'm not eating outside food, still I have bloating, then comes the role of nervous hypersensitivity. And here comes the role of integrated care. And this could be because of your small intestinal bacterial overgrowth. It's a condition wherein your healthy and unhealthy bacteria in your gut, the balance is destroyed. And there are a lot of um, microbiota that are producing a lot of gases. So after all, the gas that are produced in the intestine are because of microbes eating the food that you have ingested, and they will lead to, during the metabolism, that will lead to a lot of gases like CO2 or methane. So anybody who's having excessive bloating or belching, or even for that matter flatulence, the gut microbiome change is one important thing. And that's how treatments like probiotics or selective gut bacterial decontamination are helping in treating SIBO and bloating. But in general, we advise patients to take small frequent meals, avoid certain gas producing foods like cabbage, cauliflower, and onion, potato. uh, and these are the ones that are usually associated with excessive gas production. And we ask them to take small frequent, avoid food triggers, and chew the food slowly. If you eat food in hurry, you tend to swallow a lot of air, and this air gets trapped in the stomach, and that will lead to sensation of fullness and bloating. So chew the food adequately, practice mindfulness while eating. Do not watch TV, or get diverted in something while you're eating. Chew the food adequately. With these precautions, most of the times the bloating is controlled. If still you don't have relief, then that's time for our medications.
Thank you, Dr. Jatin. If you allow me, I can take a couple more questions. Actually, we have received almost 30, 40 questions, but of course, I understand. I'll just quickly ask one question. So this is a gentleman from Cochin. His age is 44 and he works in insurance industry. And he says, what is so different about integrated care? Like I've been going to the physician and gastroenterologist for past many, many years with a mixed result. But now I think I have finally decided to jump into this whole integrated care because I've been reading a lot. Person also knows about the mantra study because he has read it somewhere. So what he wants to know is what should I expect if I am about to start my integrated care journey? what are some of the things that will be done to me which will be very different than not done before?
So, integrated care has a personalized advice. First of all, your data is extracted. So, what are your personal problems? So giving a blanket statement or blanket medication for all patients is not the solution. Each IBS patient requires individualized care, and that's when integrated care is important. When you have multiple sessions conducted with you, there is a constant give and take of information and feedback from you and the person providing the therapy, and that will lead to adjusting the therapy. So once you see the doctor again, you come back after a couple of months or maybe 3 months for the follow, and the doctor does not have the time to um, focus on your diet or the stress part, or to give you a counseling or personalized recommendation. So he will just probably give you medications and ask you to come back. He will probably say take low FODMAP diet, avoid spicy food, nothing more than that. But he doesn't deep dive into what exactly you are consuming, and whether that is high FODMAP, low FODMAP, whether it is getting contaminated, and how much you are practicing, whether you are implementing the yoga, meditation, breathing exercises, whether you require any medications for the psychosocial comorbidities. All these things, because of constant feedback and improvisation, it can be modulated to achieve the cure. So in that way, I think integrated care is much better, because there are frequent sessions, and you can also have the access to reach out to your therapist or care provider with your questions, and you can get them answered then and there, instead of just worrying about. IBS patients having a lot of questions or doubts, and they keep stressed about those things. Any symptom that they get, they're worried, and that worry will kind of turn into a lot of vicious cycle and aggravate from symptoms. When you have rapid access to a care provider who reassures you or directs you towards a doctor if it is alarming, will lead to reduction of a lot of stress and anxiety, and definitely it has an edge over the standard care.
Thank you, Dr. Jatin. And we are almost out of time, and I apologize for shooting a couple more minutes.
No issue.
I assure everyone who still have a lot of questions, we will ensure that each and every one of you get a personalized free call with our IBS expert, nutrition expert, and that will something happen in next 2-3 days. We will ensure that you get communication around all this. And with that, we will really, really thank Dr. Jatin for his time. It has been really knowledgeable session, and me and Simran have also learned a few more interesting things about this whole IBS ecosystem. Thank you, doctor. Thank you so much.
Sure. Thank you so much, Dr. Jitesh and Simran. Thank you.
So Simran, since we have some time from the core product perspective, and a lot of queries have come about what can we really do. You saw that at least a couple of questions were all about, okay, I am converted. I am someone who is now seriously thinking about going to the integrated care. And of course, here is an opportunity to be able to show to the people that as a one-stop solution for the IBS care, IBS integrated care, how Dr. Reddy and the team has developed DailyBloom IBS Care. Maybe you would like to take everyone through the solution and the phases, and how we actually help a patient take this journey.
Yes, thanks, Dr. Jitesh, and thanks, Dr. Jatin. Side by side, during Dr. Jatin's session, I was taking notes for my own practice, that bloating-related issues and flatulence, mantra study. So thanks for that, Dr. Jatin. Dr. Jitesh, to answer your question, since Dr. Jatin has talked a lot about the integrated care and how it is different from the multidisciplinary approach. So when I talk about the multidisciplinary approach here, what a lot of people who have been diagnosed with IBS or having IBS related symptoms, they are taking some diet related changes or some therapy or certain psychologist sessions. But an integration of these three things is what is lacking. And that's where the DailyBloom IBS by Dr. Reddy comes into the picture. I'll just present my screen and take you all through the through our website, where we can find the most of the content which Dr. Reddy's have been preparing. I hope you can see my screen.
Yes, Simran, we can.
Yes. Okay. Thanks, Dr. Jitesh. So, DailyBloom IBS by Dr. Reddy's is an 14 weeks integrated care plan. And here it is actually India's very first integrated approach or program to manage IBS holistically. And we follow a simple three-pillar approach here, yet very effective. Pillar number one here is diet. And we ensure that we divide the diet into four phases. And what are these four phases? These So we take your diet and divide into four phases. The phase one here is discovery phase. So the entire purpose of the discovery phase is to ensure what has been your medical history, diet history, what foods were you eating, what foods you like, where there is aversion. So all that has been taken into account in phase one of discovery. Phase two, when I talk about gut cleanse. So gut cleanse is where you have to remove a lot of high FODMAP foods, and that is where most of the IBS patients go wrong. Yes, they are able to do the gut cleanse, but they're doing the gut cleanse for an extended period of time. And that is where a lot of nutritional deficiencies come into the picture, which again leads to a chain reaction of weight loss, energy loss, fatigue, and tiredness. So that's why in our care plan, we ensure that we do the gut cleanse for a limited period of time. After that, we move to phase three, which is called reintroduction. Now, in reintroduction, we are again introducing high FODMAP foods, but in a very scientific, controlled manner. Here, we help you understand what is your safe food portion size. So once we have understood what is your size, safe ingredients, what is the right recipe for you, we move towards phase four, sustenance, which is the last phase of the care plan. So here you are able to sustain your diet for a longer period. By the end of the care plan, you'll be able to understand what are your diet related triggers, what food suits you, what do not suit you, what foods you can eat in limited quantity. So that is about the phases of diet. So that is about the pillar number one. Pillar number two, which we also focus upon, is stress management. And in stress management, we have clinical psychologist sessions who work one-on-one with you to understand what are your stress-related triggers and how we can counter them. And there are few activities, mind and body relaxation techniques, which clinical psychologist does, and certain grounding techniques as well. And third, we also have under stress management for wellness, we have yoga, and we are the yoga sessions are happening 3 times in a week. And if any of you is free, feel free to join. They're happening alternatively. And so that is about the care plan. And yes, so your IBS personalized care plan, all of this you get just for rupees 12,000, including 15 blood tests free of cost. But since you people have joined us on a Sunday evening, sparing your valuable time, and we have special coupon offers for all of you. And all you need to do is check out the DailyBloom IBS checkout page. You can go there and make the payment and click on checkout now. You'll be taken through a page like this, and you can apply the coupon code July 30. And all you need to pay is 8,400. So this we have opened only for limited number of participants, for the 42 participants who are there for us today. For them, we have opened this special discount offer. Please make sure you take the benefit of it, because you'll also get an access to 1,000 plus free IBS friendly recipes. Along with that, you can also check your gut health index completely for free. I'll take you through gut health index, and let's see how to track what is your gut health now versus later on. Okay. I hope you can see my screen for gut health index. Okay, so gut health index has been developed by in-house gastroenterologists and doctors and nutritionists of DailyBloom IBS, and it helps us to it indicates the severity, nature, and frequency of your IBS symptoms. And a score below 40 usually indicates that we need a focus towards your gut health, feel free to take your score. Participants, you can get it on our DailyBloom IBS app. If not, it's there. We have also added this feature on our website. So all you need to do is check yours now and you'll be taken to this page. And here you can, you need to enter your symptoms based on number of days you're suffering. For example, I suffer from abdominal pain 2 times in a week. So I click on 2 times. I suffer from diarrhea 7 times in a week. And constipation, I'm not having constipation as such. Bloating, I have, for example, say 3 times in a day. And how it is impacting my life, I'll say moderately and we'll check our results. And here you can enter your name, phone number, symptoms, and then your score, numeric score will be given to you. And a score less than 40 is what indicates that you need immediate care. Okay, all right. I hope I'm audible, Dr. Jitesh.
Yes, Simran, loud and clear, and we could see your screen also.
Okay, all right. Okay, just a moment. Okay, so yes, that's about the DailyBloom IBS integrated care plan. As Dr. Jatin has previously mentioned it to us that for IBS management, we need something which is more holistic in nature. And yes, medications are there. Along with that, we need on a parallel approach as where we know what are triggers, be it from dietary standpoint or be it from stress related point of view. And I would like to share like a few testimonials here of our patients who have completed the program and they saw wonderful results. And one is a homemaker. She's from Andhra Pradesh. And before onboarding to our program, she was going through a lot. And recently, she lost one of her closest family member. And that's where her stress or emotion related triggers took a toll on her body. And before onboarding to our plan, her gut health index was 32. And before coming to us, she also tried a low FODMAP diet. But she didn't, but she saw little to no improvement in her symptoms. But later on, once she was onboarded, her gut health index score soared from 32 to 96, almost 200% score change was noticed
And
then and there.
Simran, if you don't mind, how much time did it take for her to register this kind of progress?
Yes, so in the within first 2 to 4 weeks, she started noticing change in her symptoms, and she found greater relief from bloating and abdominal pain.
Can I ask a small question, right? Dr. Jatin went at length to explain that how a journey of a person who is now new to integrated care, right? Someone suffering from IBS for years and now has taken this journey. Now, exactly, let's say if that patient is going through this program, in the first 1 month, obviously there are those multiple phases that you have shown, the initial phase, the second, the third, and the fourth. But matching to what Dr. Jatin was explaining, what should a person expect? Let's say in first say 4 or 5 weeks, right? What are things that the person, and of course the testimonial that you're still speaking about, So can you maybe give a live example and just give a feel that what should a patient expect when they are taking this journey, maybe in first 4 or 5 weeks? What will happen to them?
Okay. All right. Thanks, Dr. Jitesh, for that question. And when the patient is onboarded on the care plan, the very first, the phase 1 discovery phase is what patient is supposed to complete. It's a one-time nutritionist call where we deep dive into patient's medical history, diet history, and what have been their challenges with gut health and IBS. Once we have taken that into account, we move to phase 2, which is called gut cleanse. Now, here in gut cleanse, what are we doing? We are removing all possible sort of triggers, high FODMAP foods, which can trigger their IBS symptoms. And once we have done that, once you have completed gut cleanse is, by the way, is for 4 weeks. And once the patient has completed those 4 weeks, they saw a noticeable change in their symptoms, and definitely their score also changes.
Kindly carry on with your testimonial.
Yes, okay. Thanks, Dr. Jitesh. So that's what about the care plan in the first few weeks once the patient is onboarded. And again, coming back to my testimonial where the patient saw noticeable change in their symptoms. And yes, so before onboarding, the score was 32. After onboarding, it went up till 96. And her major concerns about emotional health were also taken into account. She was able to have better control over overall on her life because she was able to manage her issues like anger, frustration with the clinical psychologist session. In addition to this, she was able to enjoy her food favorites like non-vegetarian food because a lot of time IBS people have this perception that we cannot enjoy non-vegetarian foods being on the care plan, but that was not the case for her. And another second interesting testimonial was for a student from Jharkhand who is 21-year old and who mentioned it to us that I have been diagnosed for IBS for over a month only now. So I want something which is a quick fix and I can probably have those kind of meals and recipes where I don't have to dedicate much of time. So for him, we provided with easy, simple recipes, one pot meals, sandwiches and smoothies. And the psychological sessions really helped him to grasp and come back again on the academic level. And his gut health index also improved from 61 to 86. So that is about the testimonials here. I want to talk about the value offer. I think another 1 or 2 minutes we have with the session. And to all the 33 participants, we still have 10 more seats left. Make sure you take the advantage of today's Gold Care plan. You can check out our website. There you can apply the coupon code for July 30 and can avail the care plan for only rupees 8,400. I hope all of you make the benefit out of it because we're also offering a lot of recipes, a gut health index tracker, and some nutritionist and psychologist sessions as well are there.
Thank you, Simran. I think thanks to you and of course Dr. Jatin for bringing this knowledge and not only bringing a knowledge but closing the loop with an actual solution, which is like a one-stop solution for anything IBS, and especially for people who want to take an integrated care journey. They want to bring joy back in their life. They want to lead a productive, social, mental, and personal health and life. And cannot thank you enough for bringing this expert care. And of course, the promise stands for everyone who has written a question. We will ensure that you get a free expert call. I will also reiterate the point that Simran has raised, that she spoke about certain value offer. And maybe if people feel that that is something they are looking for, this is a great opportunity for them to grab that offer. And I think with that, we have come to an end of this session. I guess would like to thank everyone for your time and we'll connect again. Thank you so much. Thank you, Simran.
Thank you, everyone.